ABC Radio Australia.
Sharing a Pacific morning.
In Papua New Guinea, malaria is a big problem. But let's go back to basics. What is malaria?
Malaria is a parasite. It's a parasitic infection. It's transmitted by the female Anopheline mosquito in tropical and subtropical regions of the world.
That's Dr. Leanne Robinson from the Burnet Institute. So basically what happens is that during the female mosquito's reproductive cycle, she sucks up blood so she can have her cycle and lay eggs. The problem is that if she takes blood from someone who's been infected with malaria, then the next time she goes to suck blood for her next cycle, she passes the malaria on to that person. And so the cycle continues over and over again. So going back to Dr. Leanne Robinson, for the past 10 years, she's been working mainly in Papua New Guinea to understand the transmission of malaria, the burden it causes to those afflicted with the disease, and she's been doing intervention trials in the hope of reducing the problem.
The coastal and lowland areas of Papua New Guinea in particular just provide the ideal breeding grounds for the mosquitoes that transmit malaria. So combined with a population that has a high number of infected individuals, this creates a cycle of transmission that's very difficult to break, because not only do you need to have very effective case management in treating everybody who has the parasite, but you also need to find a way to reduce the number of mosquitoes that are biting those people and reduce that human vector contact to break transmission. And this is even further challenged because not all people who are infected with the malaria parasite are sick clinically. So people can have the parasite without being sick, and therefore they don't seek treatment at a health facility, and so they aren't diagnosed and treated quickly.
And when it comes to malaria, there are groups that have a higher risk of severe infection. These include children under 5, those who lack protective immunity, and interestingly, pregnant women, which is one of the areas that Dr. Robinson works in.
Malaria infection during pregnancy is really a major public health problem. This is because, during pregnancy, there is an additional organ or tissue that the malaria parasite can sort of hide in, and that's the placenta. And so this means that we're not able to easily detect them in the mother. And the woman may not necessarily feel sick, but they can have really serious consequences, both for the mother and the baby, ranging from maternal anemia, fetal growth restriction, premature labour, and even death of the mother or the fetus. In PNG, we're working in partnership with the PNG Institute of Medical Research, the East New Britain Provincial Government, and it's funded by FIND, the Foundation for Innovative and Novel Diagnostics, to look at comparing the ability of some different diagnostic tests to be able to detect these infections during pregnancy. So there's been a new test developed in the last couple of years that is a point-of-care rapid diagnostic test, similar to the one that's being used in PNG and other malaria endemic countries as part of standard diagnosis of malaria. But this one has a 10-fold greater sensitivity. So we are screening mothers who are coming to antenatal clinics in East New Britain province using this new test, as well as the standard test. And we're also doing some very sensitive molecular assays in the laboratory, and we're comparing the ability of these tests to see, is it actually worth us thinking about how we might be able to use this high sensitivity test in PNG as a way of improving the detectability of malaria infections during pregnancy.
So that's the treatment. I'm just thinking when you was just saying just stop mosquitoes from biting people, like obviously that's one of the answers, but I don't think that the mosquitoes are going to listen to you. So how do you do that?
It's a good question. So I guess one of the key malaria control interventions of the past decade have been long-lasting insecticide-treated bed nets. And so bed nets operate efficiently not only to provide personal protection in that when you're sleeping under a bed net, you are protected protected from the bites, but they're also insecticide treated. And so mosquitoes can only fly certain distances before they need to rest on a surface. And so when they rest on an insecticide impregnated surface, then they die. And so LLINs are a very, very effective tool. If you couple that intervention with effective case management, where all people who are sick seek treatment very quickly and receive an effective treatment, then you can really have a profound impact. However, it doesn't reach all areas of, as you say, it's like, how do you do that? And I think particularly in countries like PNG, we have additional challenges where the mosquitoes also tend to bite earlier in the evening and outdoors. I think in PNG there's also a little bit less of a distinction in some areas of the country between indoor and outdoor transmission. And so we need new tools as well that can target the mosquitoes that transmit malaria, not only LLINs. We also need, new tools that will allow us to better diagnose those individuals who are infected but not yet sick, so that we can also target interventions towards them, because they can also be sustaining transmission.
And I'm just thinking too, to seek treatment. I guess it's easy for me in Melbourne. If I wanted to go to the doctor, I just, either walk down there, catch a tram, and I've got lots of options. But for a lot of people in Papua New Guinea, they live in remote and rural villages. So especially if they're not showing any symptoms that something is happening, how do they access treatment?
It's very difficult. It really is. And so I think that is a real limitation, of the current sort of case management strategy that is employed in most countries, is that it only reaches those people who are actually able to reach a health facility. And for many people, just as you say, their nearest health facility can be 3 or 4 hours walk. And so again, it's a trip they may make for their children if their children are very sick. But if they're just feeling a bit febrile and a bit, these are people who have had malaria many times throughout their life as well, they're less likely to make that trip until they're very, very sick and in need of treatment. There's been a large push in many countries towards trialling interventions that are more community-based, where volunteers within the community were trained how to use the rapid diagnostic tests for malaria, so that people could go to that person within their community and get tested, and if positive, treated with the effective anti-malarial.
Another challenge is that mosquitoes are evolving thanks to the pressure being put on them. This means that they're actually becoming resistant to the insecticides which are trying to kill them. Thanks, Darwinism. But despite this, the World Health Organization has a target of eliminating malaria by 2030, which is only 11 years away. Are they dreaming?
I think it's a goal worth having. I think it's very important that globally, as well as for the region, that we really rally agencies behind the goal that malaria elimination is achievable, and that it's something that should be prioritised. It's something that is worth investing in order for a healthy country, a healthy workforce. Do I think that, malaria endemic countries in our region will achieve elimination by 2030? Probably not. I think that's a goal and it's something that will be worked towards. But I think there's certain settings where it's going to be very challenging. But by WHO and global funding agencies working with countries towards this goal of 2030, it's a really important way of ensuring continued progress and then acceleration to elimination.
That was Dr. Leanne Robinson, who is a group leader of vector-borne diseases and tropical public health at the Burnet Institute. And yes, I'm aware I'm playing Nikolai Rimsky-Korsakov's Flight of the Bumblebee when we've been talking about mosquitoes. But in my defence, the Russian composer didn't do a follow-up featuring mosquitoes. I know, I looked.